Hi there, it is Maggie. Um, so, for my clinical rotation, I was at a pediatric private practice where I mainly saw a lot of articulation and language. And then this specific case was actually my only feeding case that I had the entire time. So, that's partly why I chose this one because there were a lot of opportunities for counseling. Some opportunities were missed, unfortunately, but there were quite a few opportunities here. So to start off, um, we will refer to my client as CD. He was a 15-year-old male feeding client. He had some sensory concerns with food, just as far as he didn't really want any like liquids or certain textures really bothered him. He has an autism diagnosis. Also with has some epileptic episodes sometimes. So those are pretty few and far between. But so when he was 10 years old, he had a seizure that hospitalized him, and so before his seizure, he was already a fairly picky eater. He mainly just wanted chicken tenders, Oreos specifically, and sometimes he would eat apples and grapes, but those were pretty few and far between as well. Um, so after his seizure, he kind of like went down this spiral of like not really wanting anything to eat. So about I believe it was about a year later, he was actually hospitalized again for malnutrition, and he then got a pig tube. So he has been fed nutrition that way ever since. But his dad really would like for him to be able to eat table food again, so that's why he is in feeding therapy. Um, and he's been cleared as far as like there's no safety concern with his swallow. It's just that he is not eating enough. So um, he really is motivated by TV and video games. That's mainly how he spends his days. That's what Dad said. Dad wants to see him eat real food, like I said before, and he is living with Dad most of the time. Neither my supervisor or I are fully 100% sure of his family history, but we do know that he is on his stepdad's insurance, and he lives with Dad a majority of the time. So I do know that at one point there was question of um, putting him in occupational therapy as well because of his sensory needs, but there was difficulties with the insurance and they just could not afford it at the time. So different counseling moments that there were engaging. So it was hard to do this with the client because, like I said, he was only motivated by going home. So he did not want anything to do with feeding therapy. He didn't really care if he ate food. It was mainly his dad that wanted him to do it. Um, he scripts a lot. So mainly all of his functional language is through scripting. So it was an interesting balance trying to like figure out what scripts he was trying to use functionally and which ones he was not. I will say that I got better at understanding that as time went on. It just takes a little bit of time to do that. And then just like communicating with Dad about their weekend, making sure that I included him in conversation as well was important because um, like I said before, the main reason why CD was there at feeding therapy was because his dad really wanted him to succeed in that. So focusing, just getting him in the mindset of trying different foods, mainly fruits and vegetables is what we talked about. So for the first month that I was there, um, honestly, we just did a lot of like describing fruits and vegetables and touching them and just like familiarizing him with those different things. And then also like focusing him by giving him a schedule, telling him what we were going to do throughout the day, and having like a picture of a house at the end, so he knew that like at once we did all these things, then he got to go home, which was his main motivation. And just letting him like check off boxes as we went, so he could see like getting closer and closer to going home was very useful. And also just making visuals for him of like, we pretty much stuck with the same 3 fruits and vegetables every single week. And so I had like visuals of like his favorite movie and TV characters holding the different fruits and vegetables, or having like the adjectives, like having a picture visual of the adjectives so that he could pick which one he thought belonged to which fruit or vegetable. That seemed to work okay. Evoking, so as far as actually getting him to try the foods, again, the pictures of his favorite characters eating them definitely helped some, but he still, the whole time I was there for 2 months, and the furthest I had seen him go was chew up an apple and spit it out, which was a huge deal, and it was so exciting that I got to see that on my last day with him. But it was a lot of like smelling and kissing the fruits or vegetables. And we did notice that like towards the end that he showed a lot more interest in the fruits than the vegetables. So just kind of like leaning into that and following his lead a little bit more on that. As far as planning goes, that was mainly conversations that we had with Dad during the time, just asking him like what are ways that he could incorporate some of this therapy that we've been doing there and bringing it home, which I admit that I wasn't the best at doing that, because Dad sometimes seemed to be in a hurry to leave too, so it was just kind of like, okay, we checked this off our list and now it's time to go. So I wasn't as adamant on that as I should have been. So other counseling opportunities, like I said, Dad was the caregiver and he was there for every single session. So just getting the opportunity to counsel both him and his son was interesting. So let's see. He was definitely invested more than his son was, discussing what they used to like, what CD used to like, and kind of go from there, and what I talked about before. Giving positive feedback and encouragement to Dad, that was like a huge deal, I think. It really allowed for him to see that he is doing something right, and he is, a lot of times with these kids and these parents, like they are constantly hearing what their kids can't do and what they're not doing right. So making sure that we're incorporating like positive psychology with him was a big deal, to not just CD but to Dad as well. Like I said, we had referral considerations with occupational therapy, but unfortunately there was an insurance issue there. But we did have these like fleece sensory beans that we would use that whenever I noticed he was starting to get anxious or overstimulated, just like being able to rub them on his cheeks and his hands really helped him regulate himself a little bit, and just giving him breaks between. Encouraging transfer for these techniques at home. Like I said, that was something I wish I would have done a little bit better. And also, like towards the end, my supervisor had talked to me about if it was ethical to keep him in therapy because he wasn't making a whole lot of progress. And that was an interesting discussion, because even though I will not be there for that discussion, it is one that will be had potentially. So just realizing that is in my scope of practice to counsel Dad in this case through a difficult decision that is going to have to be made. If he is not making progress, is it ethical to keep him there? So different strengths that I had: positive reinforcement. I feel like I did that fairly well. picking up on his stressors, again, just realizing when CD was anxious and being able to use those sensory beans or take a break when needed. Engaging both dad and CD was something that I feel I did a decent job at as well. Building rapport was really huge for my supervisor, and something that is really big for me too. So just making sure I really honed in on that. Using visuals during evoking and engaging even too was big, and I think that that really helped him a lot. And then challenges that I faced, making it more client centered. I realize looking back at it now that I should have leaned more into what CD was wanting at the time. And obviously, like if it were completely client centered, he wouldn't be there at all because he didn't really want to be there. But still, like giving him a balance of making him feel like he was part of the decision making probably would have been more beneficial, and I wish I would have done more of that. While I did listen to a scripting for functional use, it took me a while to really like figure that out. So I think that that was something I could have improved on by the end. Just evoking in general, I think that I could have done a better job at that. And then I wish that I would have communicated more to dad about transferring these techniques to home as well. All right, and that is it.